at the St. John's treatment room. This is our treatment room in the hospital on the joint replacement floor. Christy is one of our lead therapists, and we're going to go over a few exercises. These are the exercises that we would do on immediately right after surgery that a patient starts while they're in bed. Christy, tell us about some of the exercises that you're going to show us and how they work.
So some of the exercises we're going to go over, they're pretty all-inclusive of whether you're a total knee, a partial knee replacement, or a total hip replacement. They are designed to promote circulation, increase your strength, and really work on your range of motion. You have a lot of new space in your joint now, so you want to make sure you're utilizing it. So these exercises are really good. You can practice them at home, so we'll just kind of give you a brief overview. So the first one we're going to do is what we call a quad set. So you're looking at this muscle here. This is what we call your quadricep muscle. So you're going to be working on squeezing this muscle. So you're going to take the back of your knee, go ahead and push it down into the bed or this mat here. Squeeze this muscle, hold for 5 seconds, and then relax off. Okay? So go ahead and push down, squeeze, 2, 3, 4, 5, and relax off. Push down, squeeze, 2, 3, 4, 5. Okay? That's what we call a quad set. The next one we're going to do is called a heel slide. So you're going to be taking your heel and sliding up towards your bottom. While you do that, your knee is going to be bending up. Then you're going to bring your knee back down and slide your leg back out. Okay? So go ahead and take your heel, draw it up towards your bottom, and then push it out. Make your leg straight. Each time you're doing this, you're trying to bring your heel closer and closer to your bottom, bending your knee higher and higher. Okay? And push out.
You know, it seems like the quad set really gets the quad, and then is that getting the hamstring for knee flexion?
Mm-hmm. Yep. Yeah. You're really working on ranging motion here and at the hip. Very good. Okay, so the next one we're going to do is called a short arc quad. Here in the hospital, we give you a towel roll that you can use while you're here, and then at home, recommend using the same thing, or you can use anything like a pillow. So you're going to take this is going to go under your knee, so you get a little bit of flexion at the knee joint here. Mm-hmm. You're going to keep the back of your knee on the towel, okay? Pull your toes up towards your face and lift your heel up, so you're getting a nice straight line here. Again, we're working your quad, okay? So you're going to hold for 5 seconds and then slowly lower it down.
Can you just go over that technique again? So it's some type of roll directly under the knee.
Directly under the knee, okay? And as you're doing the exercise, the back of your knee is going to stay on the towel roll. You're not going to be lifting your whole leg up. Bring your toes up towards your face. Lift your heel up so you get a nice straight line. Really working on squeezing here. Hold for 5 seconds and then slowly lower it down. We're not looking for you to be flicking your leg up and down. Very slow, controlled movements. So again, lift, hold for 5 seconds. 2, 3, 4, 5, and slowly back down.
And what are some of the common mistakes that people make with this? What are the technical points that you're training a patient?
Most of the time, they end up just trying to lift their leg all the way up like this.
Okay, so, and that's not the point of this?
No, that's not the point. That's a completely different exercise. So we're really working on trying to isolate the quad in this exercise, focusing on, like I said, terminal knee extension so that you're controlling your movements up and controlling them down. They like to flop their legs up and down, and we don't want that. So nice, slow, controlled movements, you build more strength that way, concentric and eccentric.
That's great. Yeah, so much of this isn't about just getting as much power as possible. It's the neuromuscular control and the neuromuscular activation.
Yes, definitely neuromuscular re-education.
And how many times should they be doing this?
Well, the whole set of exercises that we give to our patients when we come in, it's a set of 10 repetitions for each exercise, and we recommend doing those exercises at least twice a day, and you can work up to 3 or 4 times a day from there.
Okay, and I think patients should even practice these exercises, the heel slides, the quad sets, and the short arc quads, even prior to surgery, so as soon as they're done, they'll know how to do these exercises.
Correct.
Okay, can you overdo these exercises?
You can initially in the beginning, so you don't have any true restrictions or minimal amounts that you can do or maximum amounts. However, you can make yourself overly sore if you're doing too much in the beginning. So you're going to be watching your pain and your swelling, because if you're really, really swollen, you want to back off maybe the repetitions or the number of times you're doing them per day.
Okay, and these exercises are important, but are people going to have to do this their whole life afterwards?
Definitely not. Initially, you're probably going to need to do them for the first week up to maybe 3 weeks, depending on how strong you were prior to the surgery. And then at that point, they're going to be too easy. You're going to need to be advanced to something.
Right. So this is about neuromuscular control. This is just about teaching your leg how to move again.
Right.
And you're not going to have to do this your whole life. This is just in the beginning.
Right. Yeah, your joint's in a new anatomical alignment, so you want to make sure your muscles are pulling and strengthening in that new anatomical alignment.
Thank you very much, Christy.